This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle and the Roselle Center for Healing present Ageless Health 2014, Proven Tools to Maximize Your Health, Saturday, October 18th at the Fairview Park Marriott in Falls Church, Virginia. At this all-day seminar, learn how you can feel better or feel great when the doctors from the Roselle Center for Healing each discuss a topic that directly affects your health, like your food, physical fitness, preventing injury and disease, your healing process, and more. Learn more at agelesshealth2014.com. That's agelesshealth2014.com.
Dr. Tom Roselle live right now on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle live in studio, waiting to take your phone calls. Give me a call at 888-630-9625. That's 888-630-9625. Love to talk to you on any subject that you have in mind. Perhaps you've had a problem. You've tried, you applied. Well, here's an opportunity. You know what? That didn't work, so let's see if we can find something that does work and suggest that maybe there's a way to get you off of the medications that you've been taking forever or the stacks of things that you've been on, and subsequently your life has been kind of wearing thin, debilitating. Well, here's your opportunities. 888-630-9625. Want to encourage you. You know, if you truly are at a place where your health is a concern to you and your family, you want to maximize it, you really want to do everything that you can to step up to the plate, well, there's only one opportunity for you to do that, and that's October the 18th, a Saturday, and that means that you're going to join me for Ageless Health 2014. This year's presentation, we've done this program 13 years in a row. Those of you who, not 13 years, we actually missed 1 year, but it's our 13th time, and those of you who've been know that this program is over the top relative to information. And this year's topic is proven tools to maximize your health. And we're going to teach you how natural integrative medicine works with your body to achieve and maintain the optimal state of health. This is a blockbuster. You start early in the day. We go to 5 o'clock in the afternoon, and each one of our doctors presents a very specific topic on this general umbrella. So let me ask you a question. Are you ready? Are you ready to take control of your health? Are you ready to create greater wellness for yourself and your family? You know, if you are, then go to rosellecare.com, rosellecare.com, and register and do it today. Don't waste any more time. This is craziness on your part if you've been putting it off, because we're over the halfway mark now, and it's about 2.5 months away. You still have a chance to save $20. Registration right now is $79, and if you do it online, you save another $5. So go do it, because September 15th, it goes up to full price at $99, and it's done. So, and by the way, for that, guess what you get? You get all kinds of things. You're going to get all the material. You get to take them home. You get to copy them. You get an organic lunch. You get a gift bag with all kinds of things, access to everything that we're doing. We're going to have demonstrations. We're going to have a few vendors there. Really, truly, if you have any honest to God, in your heart, willingness, want to, it's now or never type of consideration to turn things around, this is an opportunity that you don't want to slip by. So go register, rosellecare.com. That's rosellecare.com, or call 703-698-7117. That's 703-698-7117, and register for this event. I promise you, I truly, truly promise you, you will not be disappointed. This is over the top, far more than anybody could possibly expect, and we do a great job. It's all for you. And, you know, it's one of those things. We lose money on this every year because we try to make it at such a low level that we can make it affordable to you. Have a lot of things to talk to you about today. I got off a plane this morning. I flew into D.C. I was down in Orlando for 4 days attending a huge convention, the Florida Chiropractic Association convention, functional medicine patterns and so forth. There's about 2,000 docs and their staff, and the information that was presented was actually very eye-opening. There's a lot of things, I teach usually for a couple hours, but the rest of the time I get to sit there and listen, and I get to figure it out and add to all those things that I want you to know about. Ran into a good friend of mine. He is the past president of Parker University in Dallas, Texas. His name is Dr. Fabrizio Mancini. And why is that important? Well, one, he was the youngest president of Parker University, and he has one of several books, but this last one is an international bestseller. It's called The Power of Self-Healing, Unlock Your Natural Healing Potential in 21 Days. Anyway, we call him Dr. Fab, is now the go-to guy for wellness information for Fox News, and we wanted to applaud him and let you know about that. So when you see him, know that he's a friend, and we've known him for a long time. But Dr. Fabrizio Mancini, Dr. Fab, is the guy. He's a good-looking guy too, so you'll enjoy his information. But go buy the book, The Power of Self-Healing: Unlock Your Natural Healing Potential in 21 Days. We may take a few excerpts from that book today because it's pretty impactful. I was very impressed. I applauded him. I said, "Hey, Fab," I said, "this is a very, very over-the-top accomplishment." And he just smiles and he says, "Yeah, I know," but nevertheless, he's a pretty cool guy. Let's talk about things about you. 888-630-9625. I'm going to go in and out today. I'm going to talk to you, and I'm going to go back, and I want to cover some things. We're going to talk about chronic pain and why it's debilitating. We're going to talk about why the United States is number 17 on the hit parade relative to health and wellness. That's right, 17. There's 17 people or 16 others ahead of us. We are at the bottom of the barrel, so to speak, and we spend more than anybody else. We're number one in the amount of money that we spend. And things aren't getting better, and we're going to talk about all those things, like heart disease and diabetes and chronic pain and kidney problems and so forth that are destroying you and taking you out. And the fix is not difficult. Judith, thank you for calling. How can I help you?
Hi, good afternoon.
Good afternoon. Thank you for being with us.
Well, I'm glad you have this show. I am curious about something because it's affecting my decision-making. And that is, I was told I had some spots in my thyroid that need to be checked, and a fine needle aspiration was diagnosed or recommended. And in reading up on it, I found that a lot of times, because the tissue maybe is difficult to extract, or reading to see if it's cancerous is difficult, they might just remove the thyroid totally, which scares me to death. And I'm wondering if I can sit on this a while and let ultrasounds guide anyone, or whether I should just get in there and do this.
Okay, so I'm going to give you this from a personal situation, okay?
All right.
I grew up with a deformed thyroid. Everybody thinks that I'm deformed, but that's neither here nor there. The left lower lobe of my thyroid is absent. Mm-hmm. I have tremendous amount on ultrasound cyst formations, mm-hmm. and my thyroid and my blood work and so forth is perfectly normal. Mm-hmm. So you, in my opinion, you keep an eye on it unless they can show you pathology. Mm-hmm. Absolute pathology, leave it alone. Here's the statistics. Even if it was cancer, and it's truly that about maybe 5% of all cysts and tumor formations of thyroid are cancer, and there's a very few percentage of those that are actually fatal. So the odds are in your favor. Mm-hmm. Okay, so it's self-contained. I wouldn't do anything with it unless they can tell you that's what it is. You monitor with ultrasound. One of the things that we refer for is thermographic imaging because it shows the inflammatory reaction. But there's things that you can do to quiet the thyroid down. First, you want to know what your exposures are. You want to know whether you've been, you're exposed to constant estrogenic input from plastics and, your dietary patterns and the food and water that you drink and so forth. Mm-hmm. If you're sensitive to glutens, which unfortunately so many of us are today, it causes what's called an inflammatory cascade. That means that inflammation goes crazy in your body, and it blocks a lot of things off, not only the thyroid and the pancreas and so forth. So you can't get the stuff that you need into these tissues. So subsequently, you end up with what's called oxidative degeneration, and the tissue begins to break down. So, we could talk about this for the rest of the show, but first you look at you look at your markers, you look at your autoimmune markers, you see what those are doing, you look at what your inflammatory markers are, take a real good look at your diet. If we can help you in any way, please, let us know. We support patients in a lot of different ways on an ongoing basis. But based on what you're telling me, without knowing what the tissue pathology came back and said, I would be encouraging you to watchfully wait.
Okay, well, that's where I'm wanting to go, but they are encouraging me because it's in both sides, a few nodules in both sides, saying there's no way to tell you anything.
Where'd you go?
Reston Radiology Center.
Okay, so here's what I would do minimally. I would get at least 3 more opinions, and you got plenty of time. You can call American Cancer hospitals. There's one, the closest one is in Philadelphia. They do integrative and traditional treatment. You can go to Hopkins. If it was mine, I'd be going in different places. I have enough certainty about what all this stuff is, but I'm not your doctor.
Yeah.
I can't prescribe medications for you. So I'm going to tell you what I would do for myself, and in the situation, as much information as I know right now, I'd wait.
Okay.
But get some more opinions. And like I said, if we can help you, please give us a call.
Well, I appreciate it. Thank you.
Judith, thank you for calling. Appreciate it. BC in Fairfax. How can I help you, sir?
Yes, good morning.
Good morning.
63 next month. Last sickness I had was aplastic anemia. Survived that at 6 years old. Was having some heartburn, so I have 2 different situations going in here. They did the blood work, of course, when I went to the doctor. PSA went from 3.4 to 8 point something. I forget what it was. And then another PSA was taken prior to the prostate biopsy. It was at 12.2. Biopsy came back with Gleason score of 6 on one and 7 on another of the. Are you familiar with the biopsy map?
Yep, absolutely.
And so now I'm on the medical conveyor belt. It looks like here, and I'm trying to weigh some options.
What are they suggesting to you?
Of course, the seeds are one. I guess what they call the radiation. Is that the CyberKnife commercials that I hear at Georgetown?
No, the seeds and the CyberKnife are 2 different things.
I realize they are, but I'm just saying that these are a few of the other different approaches.
Got it. Yep.
And what other approaches are you familiar with or recommend?
Is the tissue estrogenic sensitive? Do you know if it's a receptor site estrogen type of cancer?
I have some of the information in front of me, so I can read it to you, and you would know better than I what it is.
All right, let me give you general overall. What I'd like you to do is send me a note at rosellecare.com, and then I will really get into detail with you. But let me give you a broad brush. Prostate and breast tissue are the same, and so subsequently genetically the same. So the tissue embryologically evolves the same way. So what you're seeing with guys, as you're seeing with women, there's a whole lot more prostate cancers today because of environmental triggers and the way our diets are and so forth. Now, depends on how invasive it is. If it's broken through the capsule, the prostate surrounds itself with a container. We call it a capsule. I can get into, but it's not necessary at this point. And if it's still contained within that, then there's a lot of other things that you can do. CyberKnife, if you're going to go that route, would be, in my opinion, probably the least offensive and least destructive, leaving you more intact than other things. Again, if I was in your position, there's several phone calls I would make. One would definitely be the American Cancer Hospital in Philadelphia. The number is simply 1-800-4FOR-HELP, H-E-L-P. And give them a call, tell them what's going on. They'll give you both the integrative approach and they'll give you the medical approach. They do fractionated chemotherapeutics. In this situation, I wouldn't even begin to look at it. If they're offering you CyberKnife, that means it's contained. And so that would be the way that I would begin to explore it first. I can give you some other clinics around that do this type of work. We do a lot of work to support patients that are going through cancer therapy through acupuncture, low energy light laser, dietary change, nutritional supplementation, and so forth. So there's natural aromatase inhibitors which stop the spread of the cancer, because if it is estrogenic, that's what it blocks. It blocks the estrogen. But give me a call. From what I know about it at this point, CyberKnife would probably be the first thing that I would explore, but I don't know enough. Send me the data at rosellecare.com, and then I will get back to you. And if I can be of any further help to you, I'd be glad to do that, BC.
All right, well, very good. Thank you for the info. We are going for a CT scan next week, so I guess I should wait and get that done.
Yeah, let me know what it is. If that comes back and it's all self-contained, you're good to go, and we'll discuss it. Listen, appreciate your phone call. We've got to take a break for some information. Be right back.
Dr. Tom Roselle and the Roselle Center for Healing present Ageless Health 2014, Proven Tools to Maximize Your Health, Saturday, October 18th at the Fairview Park Marriott in Falls Church, Virginia. At this all-day seminar, learn how you can feel better or feel great when the doctors from the Roselle Center for Healing each discuss a topic that directly affects your health, like your food, physical fitness, preventing injury and disease, your healing process, and more. Learn more at agelesshealth2014.com. That's agelesshealth2014.com.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio, 888-630-9625. That's 888-630-9625. That's how you find me right here today, the 24th of August. We're not supposed to date programs in case they want to replay them, but you know what? Since I do them live all the time, it doesn't matter. So I'm here, 888-630-9625. Love to talk to you on anything you have in mind. I've got all kinds of stuff because I'm back from a trip in Orlando, got off the plane at National this morning, got some breakfast, came to the studio, and I'm sitting here thinking, okay, with all the stuff that I learned and I was exposed to and that got me going, what am I going to share with you? What am I going to get? And it's like we need about 5 hours to go over this stuff. But the biggest problem that we have is the American health system. It fails you. It's not working. And subsequently, you're being, slowly taken out. The number one problem today that's facing Americans is diabetes, and then heart disease, then stroke, ladies. That's the number 3 thing that takes you out. And then number 9 is kidney problems. And I'm doing them in a lot of order, but for a reason. And what you have to understand is that they all have a lot of similarities and things in common, particularly heart disease, diabetes, stroke, thyroid problems that are inflammatory like Hashimoto's thyroiditis and things of that nature. And what is it? It's our diet and our exposures and our lack of activity and our sitting in front of the tube and our pads and all the things that, waste our time, and we're not doing anything, to fix it. So you go through and you start looking at it. You look at the fact that, this country that spends billions and billions and billions of dollars on healthcare, and we're down the tubes. We're down the tubes. Number 17, more than half of all the procedures that your doctor tells you, from surgical intervention to chemotherapeutics and so forth, have absolutely no benefit. And there are more than that can actually harm you and cause problems. It's called iatrogenic diseases. It's called physician-induced. They did it to you. Yeah, that's a real condition. Look it up, iatrogenic. That means your doc didn't tell you about the side effects that were going to happen when you started taking this junk, and subsequently, or the procedures, and you end up in a worse situation than you did before. So when you look at the healthcare system, you look at it from my perspective, that you have full and total respect that the body has the capacity to reverse virtually anything, then you start getting cranked up a little bit, knowing where we stand on the healthcare hit parade relative to everybody else on the planet, and having that we spend a lot of money. You got to ask the question: where's all the cash going? Where's it going? And we got a lot of this I want to go over with you. I want to tell you why, and it's if I don't get you jacked up, I don't know what will. But I'm going to try real hard today to get you to take action and to do some things to help yourself. In the meantime, Mike, thank you for calling. How can I help you, sir?
Yes, sir. I am 46 years old and very excellent health. But started last year, I started having some libido issues and then some performance issues as well. So I've gone to my primary care, who did some blood work, things like that. Said, it could be a combination of things, but we'll just monitor it. After 6 months, I went back. She did some more blood work. This time she wanted to check my prolactin levels. My prolactin levels were elevated above the normal ranges. So they said, let's wait 3 to 4 more weeks, come back, we'll repeat that test to make sure it's not a fluke. And, of course, it was still elevated.
Mike, let me ask you a couple quick questions, okay? I want to get down to the P's with you, and I can help you. How heavy are you? What's your weight?
I weigh 171 pounds, and I'm 5'9". All
right, so you're definitely not overweight. Weight really has to do more with the composition of the weight and not how much you weigh. I mean, for example, when I was playing ball in college, my playing weight was 218, but my body fat level was 9%. Today at 197, 198, my body fat is probably 50% more than that. So it depends on how that's all spread around. But here's the deal with libido, and I'm probably going to hold you over after in the news or when we come back.
Sure.
You're too young to have problems. And a lot of that is exposure. A lot of that is what's converting, what's not converting, what's available. Everybody wants to talk about testosterone right now because it's huge business. And the problem is there's tons of side effects, but it goes far more than that. Here we go to this inflammatory cascade problem that we talked about a little while ago. So you know how it works. The pituitary releases something called LH, which is luteinizing hormone, which stimulates the testicles to produce sperm, but also increases your testosterone levels. Now, if there's a tissue insensitivity, the inability for that to happen, then you got a problem. The fight-flight system, the adrenal glands, the outer shell of the adrenal system, also helps produce androgens, your estrogens, your testosterones, your progesterones. Now, if you're under a lot of stress, have been for a long period of time, for a lot of different reasons, then that HPA axis, which is going to stimulate all the other organ systems, is not going to work. But I'll tell you what, hang on, because I'm coming right up to a hard break. Don't go away. We're going to discuss this because I really want to explain it to you and every other guy that's sitting there, and our female listeners as well, because the pattern is the same. You're listening to Dr. Tom Roselle Live. We'll be right back.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live in studio. Give me a call, 888-630-9625, 888-630-9625. Don't forget, Ageless Health 2014, October the 18th. Be there. If you have any consideration whatsoever of really turning around, if enough is enough already and you want to be well, I'm going to show you how to do it. We're going to show you how to do it, and we're going to give you a plan to take home and apply the very next day. So please join us. You can go to our website at rosellecare.com. That's ROSELLECARE.com, or call us at 703-698-7117. Don't forget, you still get to save a little money if you do it within the next couple of weeks. If you don't, it goes to full price, which is $99. But let me tell you something. Either way, you can't beat what we're going to give you. I mean, and you get to register as well for $1,000 worth of health care. We put you in the pot. You got to be there at the end of the day to get it, but nevertheless, you get to register. Okay? 888-630-9625. Call me right now. Let's talk about you. And Mike, you still there?
Yes, sir, I am. Okay,
buddy. Let's talk a little bit more. First, some quick questions. Are you on any medications?
No, just I take some herbal things, and that's about it.
Okay.
No prescription.
How do you sleep at night?
Well, I have some breathing issues in my with restricted airways a little bit, so I use the breathe right strip, so I'm not sleeping the best.
Okay. Okay. Is your room completely black?
I have done. I black out all the LED lights, flip the everything I can. Yes.
Okay, good. So, you're not that overweight. We don't know what the composition is, but I doubt that that's a problem. You take a look at things like, what your diet looks like. You look at any injury that you may have had where you're running around with chronic pain. You look at the patterns of stress that you're under. Stress is the number one killer that knocks most guys out. You're at that place in life where guys always seem to have some issues. Now, the biggest problem that we're talking about is lifestyle and environmental for most men or pain patterns. Why is that? Well, we're seeing things today that are not acceptable. What do I mean by that? Guys who are in their 30s today have the sperm count of guys who are in their 60s in the 1950s. So we're seeing something called the vanishing male. And it's not okay. If you watch the television commercials, Viagra, Cialis, and so forth, they're targeted to guys your age and younger.
Right.
And it's because guys are losing it. So when you look at your testosterone level, if your blood testosterone level is normal, that you're looking at the total amount.
I was at 600 on that, yeah.
Okay, so you're within the range. Did they do your free testosterone, the conversion?
Yeah, it was like an 8-point. It was kind of low to middle.
Okay.
Up scale, yeah.
All right, so that tells me that you're getting beat up a little bit along the pathway, but it should still be usable. So that tells me now that we've got some blockage. It means it's not getting into the tissue site. So that inflammatory barrier that I talked about a little while ago is one of those things that will affect libido, will affect capacity and performance and so forth. So if you can't transport it, then the body has a self-regulating mechanism. It begins to shut it down. It says, okay, enough's enough. I don't need this, particularly if you keep doing the same thing over and over and over and over again. So we have to take a look at that. We look at structural problems. We look at the nerve roots that furnish it, the acupuncture systems that deal with that. And then you begin to balance that out. But at your age, there's no reason why you can't turn the machine back on.
I'd like to add just one thing. Well, like recently I did just do an MRI.
Okay, and
there was a micro
epidermitis.
Yes.
Okay,
yes.
So that means nothing. That just means you got a little bit of inflammation someplace along the line. But the rest of those questions have to be answered. Why isn't it attaching to the receptors? Right. And so my guess is that it's either exposure. What do you do for a living?
I'm a full-time SWAT officer out here in Washington, D.C.
Okay, so, there you go. You're exposed to a lot of stuff. You don't know what you're exposed to. Your stress level's over the top when you do have to react. And, so you got a lot of other little things. Mike, love to help you in any way. There's no reason that you should be shut down. And there's lots that can be done, but you got to find out which piece or many pieces of the puzzle are affecting you. But that's where you start as far as looking through the maze of this thing. So, but you're young enough that, and the fact that you're within the normal limits tells me that there's other pieces that can be naturally brought back in online. Okay?
Okay, thank you, sir.
You're welcome, Mike. Give me a call if I can help you. Appreciate it. 888-630-9625, talking about all kinds of things. We said that the American healthcare system is failing you, and it really is. You're being duped in a lot of different ways. We spend the most money, as I said, on healthcare, and we get the least back for our buck. It just nothing is. We're sick. We're sick people. We're way down on the last line. I mean. Everybody spends a lot of money, but we spend the most, and it's like 30 cents of every dollar is wasted on your health care. And I said, wasted? It's crazy. That we put together more money in stupid things and the research because it funds somebody who has a big lobby bankroll. Now, I said that, and, anybody wants to challenge me on it, that's fine because I've got the data. And we can sit here and we can discuss it, and I'm happy to do that with you. But, we're going bankrupt. The number one cause of bankruptcy is healthcare bills in this country. And there's so much more that you can do. You don't need the drugs. You don't need all the interventions. You need things that can bolster your body's own innate capacity. But think about what you eat. Think about the junk that you eat. Are you eating natural foods? Are you eating things that are organic when you can get them? Or are you doing quick stuff? Are you shopping in the center of the market instead of on the perimeters of the market? And you eat all the box stuff and the fried foods and all that junk. Are you under a lot of stress? Do you exercise at all? Is your belly too big? Is your exercise flipping the remote control? I mean, seriously, think about it. I mean, the only person that you got to answer right now is yourself. How many medications are you on? Have you looked up the side effects of the medications and see how one cascades to the other? Have you tried anything else? Or do you buy into the, well, my doctor told me this, so it must be true type of attitude? Well, let me tell you something. There are many other ways of handling the same piece. Chronic diseases in this country are over the top. They're over the top. And it's because we're stacking one thing on top of the other. We take one medication to handle something else. We don't have the coordination of care. How many of your doctors will talk to another doctor, will pick up the phone and call them, or that look at it multidimensionally? In our practice, albeit we do it from a non-drug, non-surgical point of view, but we look at it nutritionally, we look at it structurally, we look at it neurologically, and through the energetic pathways of acupuncture, and we try to come up with a why is that? What are you doing? You get out and walking? I mean, if you walk 2 miles a day, just get out and walk 2 miles a day. I don't care how fast you do it. Just go for a stroll. You decrease your rate of dying from any disease process by 50%. You don't have a teacher, an educator. The term physician really means teacher, and you're not getting it done. Why? Don't ask me. George, how can we help you? George, are you there?
Yes, always a pleasure to talk to you.
Thank you, sir. Thank you for calling.
The issue you're talking about with testosterone, the gentleman that just called.
Yes, sir.
I have to reiterate what you're saying about the physicians. I'm about your age, probably about your height, a little heavier than you, and I work out all the time. And I find it curious that when you go to the doctor for anything, and I have half a dozen friends that are PhDs in various fields, no doctor that I've ever been to, and after talking to these friends of mine, has ever said you need to join a gym. I mean, maybe at the end of the conversation, you go in there and you say, well, maybe I should work out. And the doctor will say, yeah, that might be a good idea.
Hey, George, let me give you a clue. Most people aren't fat until you weigh more than the doctor that you're seeing.
What?
I said most people aren't fat unless you weigh more than the doctor that you went to see. Okay, but trust me, that was something that was investigated years ago, and that happens to be the truth. And the other situation is, too, you're not out of shape unless you're working out less than the doctor that's in front of you. And think about how many guys that you go to, guys, women, whatever, that are actually in the gym and lead the life that they're trying to tell you to lead.
Well, absolutely, and I just want to tell, like the guy that just called in out there, please join a gym. Maybe you are now, you might have other issues, but, going to a doctor to try to get specific, and I'm not discounting doctors at all, I'm really not, but the doctors seem to be discounting exercise because I've never been to one that says, I had a breakup years back with a girl I lived with for 12 years, and I was in the toilet. They want to put you on everything.
Sure.
And I just asked him, I said, well, I'm going to go back to the gym. He goes, well, that might be a good idea. I'm like, well, why don't you tell me that to begin with?
Yeah, but how about start moving around, start doing the things that you need to do, get a shift in your life. Exercise, diet, stress reduction will take care of the majority of problems that are haunting us as citizens in this country, and I say that simply because
you're right on point there, and I just don't understand why, with all the health care coming down, they don't say, okay, you get a membership, a gym member. Why are the gyms not successful?
George, because it's not putting money in somebody's back pocket. You got to remember the guys that win with this new Affordable Care Act, the drug companies. They're going to make more money off of this than they've ever made before, and I can show you the data. It's crazy. George, listen, I really appreciate it. Thank you for supporting this. It's a constant situation, and we see it. I get angry. I go over the top. It's nuts. Richard, how can I help you, sir?
Yes, sir. Two issues dealing with the same part of the body. I had eczema on my testicles and went to 3 different dermatologists. Finally got rid of the itching and burning, but I still have the redness. They don't seem to be able to help me with that. I've been putting coconut oil on, which has been very helpful, and I've been putting on another aloe oil that I got at a health food store that seems to be working.
So there's a couple things that you have to take in consideration. A lot of that redness that goes to the scrotal sac and into the groin area has to do with mold, fungus, yeast type of problems, and if they don't treat that or you don't change the environment of your body, it just never goes away. It always will flare up under different types of situations. It'll get worse. If it's a true eczema, it can be a contact problem, meaning that you're sensitive to whatever your clothes are being washed in, or that you're being exposed to any powders or anything that you're putting on. I'm going through. I'm not saying those are necessarily yours, but those are the things that you'd look at first.
I think the fungus has a lot to do with it. I have trouble with avoiding sweets, and I think that's...
Yeah, you probably always have the problem then, my friend. Unfortunately, you've got to eliminate, if it's a fungal problem for a period of time, and fungus is one of the most difficult things to get rid of in the body. I've been in practice, I'm in my 38th year of practice, and I see this stuff all the time, but you've got to avoid the sugar, the alcohol, the fast-acting starches, the things that convert into sugar very quickly. You got to limit the amount of fruits and only have the fruits that have the lowest index. And one serving a day means about a half of a cup. You got to get rid of peanuts
half a cup of what?
Fruit.
Fruit. Okay.
You got to get rid of the peanuts and the peanut butter. You got to get rid of mushrooms. Those are all fungal types of things that continue to perpetuate an underlying problem. So. You got to do a self-study. If that's the deal, then I would definitely shift the diet. I would keep that area as dry as you can. If you're not wearing boxers, wear boxers so you get a lot of, air and circulation. And then there are very specific types of antifungals that are out there. I don't know your health status, and it would take me a while to go through it, but traditionally, things like Paudiarco, Ipsirola Pacho. It's all the same thing, by the way. And you can take it in a tea, 3-4 cups of it a day, very strongly brewed. Caprylic acid is one that is traditionally used for mold and fungus. Again, I'm not prescribing to you, but I'm telling you those are things that are out there. If you look up any self-help journal, they're going to tell you about those things. I hope that helps you. If I can be of further help, give me a call, or actually the fastest way to ever find me is email. So go to rosellecare.com, ROSELLECARE.com, and Richard, let me know how I can be of use to you. Gabriel, how can I help you?
Hi, Dr. Roselle. It's a pleasure speaking with you. It's the first time listening to your show, and I'm really enjoying the information and just reading about you. It's a pleasure to speak with you. I run lots of Spartan races and just different obstacle course races, and I work out fairly, 5-6 days a week. I was going to ask you, I've seen a lot of different recommendations for cramping and building up just during the race. I've seen calcium, magnesium taken during the race, that prevents that. At least I was reading an article about that. Is there anything you would recommend to prevent cramping?
I'm going to, without knowing your physiology, which would take us a while to get into, I'm going to give you a couple quick things. One, the primary situation that most athletes cramp is dehydration. And even though that you think that you're getting some, you may not be getting enough. So one of the things you can do is you get a liter bottle, you put about 6 ounces of organic apple juice in that liter bottle, you put 1/8 of a teaspoon of sea salt, it has to be sea salt, and then fill the rest of it up with water. While you're going through the process, then that will hydrate you and it will get it deeply into your tissue. Using sea salt on a regular basis. Salt is not bad for you. You need it, but it has to be a combined product where you have all the minerals in it. Sea salt's the guy. Magnesium is an absolute. That's one of the number one things that we're deficient in across the board. 80% of Americans have low levels of magnesium, so you've got to get the levels up. So you take that on a regular basis. Just doing those things will dramatically limit most exercise-induced cramping. Now, there's other things that you can do, but again, I'd have to know more about you. But those are quick fix things, and I would encourage you to try them.
Thank you very much. I appreciate that.
You're welcome, Gabriel. Thank you for calling. We have a couple more calls. We're going to try to get back to you, but we're coming up for a break in just a very short period of time. But remember something. You have the capacity to change virtually everything that goes on with you. And it's sometimes studied ignorance. We want to believe somebody else before we believe our own capacity to assimilate data. Our Creator gave us a machine with every drug, with every neurological input, with everything that it ever needs to heal itself. Make use of it. Don't put it aside. This is Dr. Tom Roselle. I'll be right back after some messages.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
Welcome back. This is Dr. Tom Roselle. You listen to Dr. Tom Roselle live every Sunday, 12 o'clock, right here, bringing you the best and the most important and the most updated information on integrative and alternative care. If you'd like to talk to me or get a hold of one of my docs, you do that by 703-698-7117. However, as I said, the best way to get a hold of me and get me to respond quickly is by email, rosellcare.com. That's ROSELLECARE.com. We still have a whole lot more up here on the board, but I'm going to take Bernice. Thank you for being so patient.
Hi, good morning.
Good morning. You want to talk about leeches or spirulina? I can only take one.
Well, I just want to know how much spirulina I could take if I'm healthy, and how many pills about.
Well, you got to be careful with it. I mean, spirulina is best taken in powder form. It acts faster. It's a detoxifier, as you know. It's considered a crazy superfood because it has all types of amino acids in it. The problem is it's an algae, and even though that it's a microalgae type of thing, but the problem is that if you have any sensitivity to algae at all, you could have a sensitivity to spirulina. It's it's hailed as this thing that fights everything from cancers to different type of disease process. But the huge effect is its antioxidant capacity, and it does, because of the combinations of amino acids, it does, and vitamins and so forth, gives a lot of energy and high nutritive value to the body. But you have to play with it a little bit to see what happens. 1 to 5 grams of spirulina is usually the dosage that a lot of health practitioners recommend. I wouldn't take any more than that. I think that's plenty. There's times that we'll walk people through other levels, but it's because they have a very specific problem. Again, the biggest problem that you have is that it detoxifies, so you can get sick, you could get migraines, you can get headaches, you could get skin rashing because it's going to come through the body. As far as a permanent damaging type of thing, no, unless you're allergic to it, and then you end up with that stupid inflammation that we've talked about that can cause all kinds of problems.
Yeah,
so
I take about 2 or 3 a day, and they're 500 milligrams.
Okay, so 2 is 1 gram, 3 is 1.5 grams. So you can work yourself up higher with that, but see how you feel with 2 or 3 grams and play with it, but do it slowly and don't do it very quickly.
Okay,
Bernice,
will it just help eyesight?
Will it help eyesight? Only from the place that it is, that it's a huge antioxidant, and because of that, it can make a difference. I got to cut you, my friend. Thank you for calling, and thank you for being patient. I really, really appreciate it. We tried to give you the most intimate and interesting information that we can on every type of processing that your body does. And I'm not using the word disease, dysfunction, because that's the end product. If you learn how to take care of yourself from the beginning, meaning you learn how to deal with your structural injuries, you deal with the biochemical imbalances in your system, and then everything works. I'll see you next week. Same time, same old place. Tell your friends about us. This is Dr. Tom Roselle. Love you all. Bye. This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellcare.com.
Dr. Tom Roselle and the Roselle Center for Healing present Ageless Health 2014, Proven Tools to Maximize Your Health, Saturday, October 18th at the Fairview Park Marriott in Falls Church, Virginia. At this all-day seminar, learn how you can feel better or feel great when the doctors from the Roselle Center for Healing each discuss a topic that directly affects your health, like your food, physical fitness, preventing injury and disease, your healing process, and more. Learn more at agelesshealth2014.com. That's agelesshealth2014.com.